Hello everybody, welcome to Being Kambua. I am so glad that you are here. I hope that you're keeping well, you and the people that you love. I also hope you have told them what time it is and that they need to be here on Being Kambua as we premiere this episode. Every new week has a different conversation that will stir you up, that will challenge you, will give you information that you will listen and be like, I really needed to hear that. And then you will be itching to share it with somebody. And that's when I encourage you to click the share button. Make sure that the content is going far and wide. Share it on your WhatsApp groups, on your Facebook status, on your Instagram stories. And of course, if there's something that you want us to talk about, please go ahead and send me an email, beingkambua@gmail.com, or you can slide into my DM on Instagram as well. I read my messages. We go through our YouTube comments. I try my best to respond to almost all of them. I try. So because I like to get your feedback, to know what you want us to talk about, because this show is for all of us. It's not a Kambua show, it's a us show. Yeah, I am so grateful to Dusit Princess for this beautiful space where we've had access to prepare this content. But I also invite you to come and wine and dine at Dusit Princess. It's in the heart of Westlands at Church Road. Really nice. It's a hidden gem. You know, the real hidden gems. This one is one of those. Today, I am joined by, when I met Dr. Achieng, I have to tell you, I was like, hiya. She's like a period doctor, like periods. She's a gyna, but like she talks so much about periods, and I was so excited. I'm like, I have to bring you to talk to the women on Being Kambua as well. Hi, Dr. Achieng.
Hi, how are you?
Good.
Thank you.
You look amazing.
Thank you for having me.
Karibu. I have to tell you, Dr. Achieng has come straight from the airport. So please feel very honored that we've pulled her and gotten her to just to be here to share her insight, her expertise and experience here with you, so that you can leave this episode saying, I feel so much better and there's so much clarity about my menstrual cycle and just how to fully understand how the cycle works. So first of all, because I've told people ametoka airport, sijui amefika sijui wapi, where do you live, Dr. Achieng?
Yes, I don't live very far.
Yeah.
I live in Kigali, Rwanda.
Yes.
I relocated some time back for family reasons.
Yeah.
And I've been enjoying my time in Kigali, but once in a while, I come to Kenya because of family, friends, work, etc.
There are different reasons.
Yeah.
You are a gyna. You also wear other hats. You're a wife, a mother. How many children do you have?
I have two boys.
2 boys.
One is 9, one is 4.
Yes.
They're really the loves of my heart.
Yeah.
Let me not start crying.
We have tissue, by the way. Tukasawa, we are ready. Okay, let's just dive right into it, Dr. Achieng. I'm usually very curious to know why people pick the professions that they pick. What's your why? Why did you choose to be a gyna?
When I chose to be a gyna, it wasn't a very dramatic reason.
Okay.
It was because I was not good with losing patients. And I felt like in obstetrics, you'd get really severe cases where you think people would be off, but it's like God's protection. I don't know how to explain it, but it was one of the things I looked at, because looking at pediatrics, I really struggled with seeing sick children, though I did work in pediatrics for a bit.
Yeah.
But that's one thing that I love, that in OBS, there's this, it's more often than not a happy ending.
Right.
A new baby, new life.
Right.
So it was always very encouraging. And of course, there is the gynecology side where now menstrual health plays a big role.
Yeah.
But I just enjoyed taking care of women in general.
Yeah. So I want to, just to kick off this conversation today, I want to read for you a tweet that came up on my timeline today, and I shared it on my stories. And this particular tweet has had so much conversation, generated so much conversation on Twitter and Instagram, everywhere. So it's We Listen, We Don't Judge, Menstrual Cycle Edition. I can smell the blood on my period, and I'm always worried that people can smell it too. This is like a big thing. Let me sample some of the comments in my DM.
Yeah.
Me and my friends have this conversation every single month. I even ask her if she can smell it. Okay. This other person says, yes, I can. I want to stay away from people. I smell iron too. Totally, I am always self-conscious and I hate it. This one says, yeah. Let me tell you, Kay. For me, when it rains, it pours. I just want to quarantine during that time. Okay. Is there a period smell?
Yes.
Yeah. Do we smell?
We do, but
yeah.
Also there's a lot to do with the type of period product you use.
Yeah.
There's also your normal genetics
Yes.
and what happens to you. And there's also, I would say, if you're having other infections, it can also impact the smell.
Yeah.
For this particular tweet,
yeah,
they're talking of what sounds like the normal.
Yes, that's
smell
metallic.
That
blood.
metallic smell. And a lot of the products we use, the pads, some of them are made with synthetic material. So in terms of really holding smell in, it can be an issue. But if you're using cotton pads, they tend to be better actually at managing.
Okay.
But if that smell is really irritating you, try menstrual discs and menstrual cups.
Okay.
Because let me tell you, they lock things in there.
Okay.
So it's definitely just part of normal life.
Yeah.
And I'm glad people are talking about it. And as you can see, many comments means many people are going through it, but people have not been very vocal about it.
Right.
So when we start talking about it, we also break the shame. We also normalize something that, I mean, is normal.
Yeah.
It comes every month.
Yeah.
But just being aware that there is what is normal, but then there is what psychologically you feel comfortable with.
Yeah.
So if it's something that really bugs you, try a menstrual disc, try a menstrual cup.
How does a menstrual disc look?
And
how does it work? I know, I wish I asked you to.
I wish I came
how
with
does it work? Are you able to describe how it looks? Yeah.
So a menstrual, I would say a cup. Let me start off with a cup.
Yes.
A cup is like this.
Yeah.
And then it comes down. So it's comes down like this.
Okay.
So it's the same way you use a tampon.
Yes.
You put in a cup. Cup stays in place due to it uses suction.
Oh.
So that means it's
so it won't fall off.
Inahifadhi.
The
blood, the smell, a bit better than using a pad. Because if you're using a pad or even a tampon, because sometimes you use a tampon and then you're using a liner.
Yeah.
So the fact that some leaks, then the smell will be also will be very easy to pick up.
Yeah.
But if you use a cup or a disc, I personally prefer the disc.
Okay.
The cup came first, but that suction, it's like a learning curve for many people.
Okay.
The disc is shallower, so it's like it's shallow like this, still being put in like a tampon.
Yes.
But then it goes in and sits just at your cervix.
Okay.
So as the blood is leaving the uterus, it's just dropping straight onto the cup or the disc.
Yeah.
And then the disc doesn't use suction.
Okay.
So there's not as much learning curve or discomfort, or you need to angle it a certain way.
Yeah.
And then since it has a wider opening, it really covers everything.
The whole area.
Yeah.
Do you, when you wear a disc, how do you know, are you able to tell the disc is full, or do you know this will carry me through the day? What's that like? Because like with a pad, you can tell it's time to change my pad, or you know every 3 hours I need to do this. How does it work with a disc or the cup?
But then you can change the cup. You can put it in the morning, change it in the evening.
Really?
Yes.
Okay. Is that for everyone, or if you have like a moderate flow?
Even if you have a heavy flow, the way it stays in your vagina, it's like blocking the pathway. So even as you continue to bleed, it just holds itself up. Let me put it that way. Yes, there are those people who have a heavier flow, and even the cups come in different mLs. So you can actually choose one if you know you usually have heavier flow, you can choose a bigger one.
Yes.
I usually tell women, just with the cost of it, it's made using silicone, medical grade silicone.
Okay.
So it's safe, and you can have different flows on day 1, day 2, day 3. So you can actually use different types of caps.
Yes.
Depending on
the
day of your flow.
You know, when I was reading those comments, every time we think we know, like, you know, I'm 40 now, so you'd think I know quite a bit about periods, but there's always something new to learn.
Yeah.
Like, you can tell I have not used a cup or a disc, but maybe I'll have different feedback next time.
Yeah.
And I'm very happy we have gentlemen on this set. I was about to say, I am sorry, gentlemen, but I am actually not sorry. I'm very glad you're here so that you can better know how to support your women. So one of the comments that had so many comments under it was a lady who said for her, because she hates the sensation of a pad, a tampon, or just anything during her period, she, for the time when she's at home, she puts like a towel on her bed and she just allows her body to free bleed. And women were like, yeah, me too. I love free bleed. And I was like, women, what level of freedom is this you're enjoying? Wow, you know? And I think for me, it's just that women allowing their bodies to do what they need to do without feeling shame attached to it. Yeah. I think is just so beautiful. But before we talk about the period specifically, let's start with the whole cycle. Why is it important for me to understand my cycle as a whole?
Oh, great question. Love it, because you've used the word whole cycle.
Yeah. Yes.
Most women, when we talk about menstrual health, they just think of the days of bleeding. Yeah. But your cycle is a 28, 21, or 35-day cycle, whatever your cycle usually lands at. Yeah. Yes. So the cycle has different parts. There's a phase known as the follicular phase. You can split it into 2 or split it into 4. Okay. So if we do 2, we have a follicular phase, and the menstrual days fall under it. Yes. If we split it, and then we have luteal phase. Yes. If we split it into 4, then we consider the days of the bleed, the days after the bleed, ovulation, and then we have the luteal phase still. Okay. So the reason why your menstrual cycle is important is because these hormones that fluctuate throughout our month, they affect so many areas of our bodies, literally from our brains, heart, joints, skin, a lot of things. Yeah. There are some I haven't mentioned, but even gut health is connected to our hormones. Yes. So we should view the cycle not so much as leading me to my periods or leading me to ovulate, but rather hacking it for our own health. Why? Because the first part of the cycle, when we are bleeding, that's day 1 of the cycle, is when the first day you have your menses. Yes. When we're bleeding, there's a group of women that feel very uncomfortable, lethargic, etc. So that means they can plan their lives understanding that there's a season that they have to show themselves a bit more grace than they normally would. Yes. The example you gave of that lady who takes time off, just free bleeds, is just relaxed. Yeah. Isn't that great? Beautiful. And then also advocating for yourself. Yeah. Yes, you are doing, is it 75 hard or something? Some workout. Yes, 75 hard. I saw that. Oh my gosh, yes. And then your trainer is insisting you have to continue performing at this. That means you're not listening to your body. And let me tell you, when you don't listen to your body, it crashes. It tells you, you need to listen to me now. Yeah. So understanding that this is when I have a bit more need for rest, then makes you plan for it. Yes. You are able to explain yourself to friends if you need to cancel appointments, etc. Then right after, your energy starts going up. Why? Because estrogen starts going up. So as your estrogen is going up, you're so energetic. You can start new projects. We say even during the ovulation time, it's the peak now. Yes, you're happy. You are happy. you are everyone's friend. You're everyone's problem solver. Yes. You can do the board presentation. You are so good at everything.
You're winning.
You're winning. And then that means that if you have choice, when can I set up activities? You can actually set up your activities to align with this.
Yeah, with your cycle.
With this cycle.
Yes.
Yeah. And then the next 2 weeks, which are known as the luteal phase, the luteal phase is fixed.
Okay.
Meaning, if I have a 28-day cycle, I have 2 weeks in follicular, 2 weeks in luteal.
Okay.
If I have a 21-day cycle, I have 1 week in follicular, 2 weeks in luteal. So luteal is usually
it's 2 weeks.
It's 2 weeks.
Okay, regardless of how long your cycle is.
Yeah. And here, some of the hormones start, the estrogen starts to dip a bit earlier on. Progesterone usually starts to go up on the first week of the luteal phase.
Okay.
So progesterone is your relaxing hormone. You feel zen, you feel at ease, you are settling down, you sleep better, all those things. Yeah. All this time you have energy to work out, but you can also change your workouts depending on your energy. Yes. I'll give an example. For me, day 1, day 2, day 3, by day 2, I'm very energetic already. Okay. So that means for me, I don't need to slow down during my period. My period. Yes. I still can work. But that means I need to know what my normal is. And that's why I'm so passionate about women understanding their normal. And then there's what we call the premenstrual syndrome. Yes. When ovulation doesn't occur, the hormones start to crash because they are no longer needed to sustain a pregnancy. Yes. So they start dipping. Yes. Now the second week of the luteal phase, which is the week before your period, is when premenstrual syndrome is at its peak. Yeah. And knowing this is important because you can put in place managing techniques. Yes. Okay. Yeah. So taking time away from people to just get back your energy. Yeah. You feel more drained. You feel irritated. Brain fog also. Yeah. Some women experience migraines. So it's from physical to psychological, everything. Yeah. Yes. And there are those who don't experience it. And I keep saying those who don't experience it have the loudest voice. Oh, yeah. And those who experience it again feel so embarrassed that this is a weakness. Yes. Whereas it's genetics. Yeah. You can't say if you're going to experience some of these things, but you can learn from your aunts, your mother's side, or your father's side of the family. Yeah. How has their journey been? Yeah. So it's so important. I think one of the messages I really want to pass along is just because you do not suffer from it, please do not assume that some women are making things up. Yes, that it's psychological. Yes. Because for many years, they even had a diagnosis for it, hysteria. Yes. So hysteria used to be a medical diagnosis. Yes. And we say some women have Harper-Napale syndrome. Oh. Why? Because these hormones, remember, they affect everything. So from your brain to your heart to your skin. Yes. So when women present, oh, today I'm having joint pain. Yeah. My shoulder is frozen. Yeah. And then tomorrow I'm having migraine. And then we're like, no, there's no medical condition that connects these things. So it's all in your head. So this has happened for a bit. But it's important now for women to really know that my menstrual cycle is more than the bleed days. Right. And understanding what happens in the rest of the days also helps you pick up things that are not your normal when you are stressed. Yes. Yeah. Because when you are burning out, you're being irritable, it's not luteal phase. What is happening? Yeah. Because sometimes you might not even have ovulated. Yes. Yeah. So you need to be very aware of self because it will really help how you show up in the world. Right. Yeah.
I think that is just so, and I'm challenging myself even as I'm listening to this because I don't know that, I mean, I have the app. So, but I usually, to be very honest, I usually
use it for bleeding.
Yes. Is it today? Is it tomorrow? I'm feeling like this, but I ignore the rest of the days. And I would do myself such a great favor if I knew this is my best week in the month. This is my tough week, this is when I need to slow down, work remotely, you know, just to take care of myself better, right? You know, I went ahead and asked women too, because I told them we'll be sitting with a menstrual doctor and she can answer the questions that, you know, many times we offer each other advice that is neither here nor there. We lie to each other sometimes out of love, but how about we bring in a professional who can actually like just bring light into some of these things. So let's dive into the questions.
Great.
How do you know if a family planning jab isn't working for you? I've had my period for 2 weeks now and it is exhausting.
So I think this question also shows the conversation before getting the jab was not comprehensive. So the counseling that should have been done before the jab was given is very important. Why? Because the jab is pure progesterone that is being put into your body. That means for the first 3 or 6 months, some women have prolonged bleeding or spotting as one of the side effects. For some, it's so severe that we actually have to give them, again, some oral hormones to balance them out. So there are those women who feel like, no, for me, this is the option I still want to go with. And those women, we are patient about allowing the body to recognize that, okay, this is now our new normal. We'll continue getting the jab and then it normalizes. But the first 3 to 6 months, you can have abnormal bleeding. The concern is if the amount is too much. If it's too much, then we really have to intervene.
Okay, well answered. Hi, Kambua. I am 30 years old, no child yet. I have recently started having facial and skin tags. So this is a hormonal question. Little research I've done points towards hormones. What do they signify? Should I be worried? Especially now that I don't have a child. What do they say about my fertility?
Okay. So this is also a risk of when you Google and then you go to the worst case scenario.
Google always tells you you're about to die.
So it's good that she's actually researching. I'm actually glad that she's even aware that there's a connection between skin tags and hormones. And so I'll explain a bit about polycystic ovarian syndrome, because it tends to occur in this condition. So polycystic ovarian syndrome is when you have higher androgen hormones. Androgen hormones are hormones for men.
So the testosterone.
Yes, testosterone, the hydrotestosterone, the different breakdowns of testosterone. So we have it normally as women, but the amounts should not be so high as to cause certain changes in our body. So one thing I'd be curious to learn from her is if she has any anomalies in her flow. Do they usually disappear for some time and then she has this, when they come, they last very long and they're very heavy, because that's also a sign. And by the time you're getting skin tags, we also have to ask about insulin resistance. So it's not just the sex hormones, but also other hormones that may lead to insulin resistance, lead to skin tags as well. So if it's Picos, we are looking at acne. Did she mention acne?
She didn't, but we actually did have a guest who talked about that.
So
severe acne.
There's acne, there's facial hair that comes, and then there's unexplained weight gain. Because of the insulin resistance. So she's worried about fertility. Skin tags in themselves are not an alarm. The skin tag, I think the issue why I'd feel for her is she's mentioned it's coming on the face, I believe. And you know, for women, self-esteem, she's very conscious about it. The solution is actually to go to a dermatologist or a skin specialist, and she can get them removed. But if she cares to reduce the number that keep popping up, then she has to look into nutrition, physical exercise. And I will speak a bit, I'll expound a bit, because most women say, so you said nutrition, so what do you mean? Nutrition means you have to target an anti-inflammatory diet or an insulin-sensitive diet. So that means you're looking at carbohydrates that are not as refined, complex carbohydrates. You really have to increase the intake of complex carbohydrates and
what
then
are examples
reduce
of complex carbohydrates?
ndoma.
Okay. Ndoma,
Yes.
ngwashe?
Yes.
Okay.
So all those traditional things that
Okay.
we feel like
Yes.
we've put them to the side.
Yes.
So the refined ones, you're eating chapati,
Yes.
mandazi,
Yes.
pancakes,
Yes.
etc. You're very happy about
Yes.
that. Oatmeal pancakes are complex.
Okay.
Yeah. And also introducing vegetables.
Yeah.
What is known as the Mediterranean diet. Nuts,
Yeah.
vegetables, olive oil. So you're not just taking like red meat. Red meat is inflammatory,
right,
compared to white meat, things like fish. Also introducing some supplements like omega, vitamin D, vitamin B6. These are the ones that have been studied and linked to improving the balance of hormones.
Okay.
Another thing is caring about your gut. So taking fermented foods so that you can reestablish your gut microbiome.
Kombucha is that,
yes.
Is that good?
Very good.
Okay. Yogurt?
So, yes. And probiotic yogurt, because there's some yogurt that is just refined. Yeah. So taking all these things, because that gut microbiome also helps break down estrogen. So if you have issues there, then it messes up your estrogen. And then it messes up the other production of the other hormones. So it's like a vicious cycle.
Yeah.
So women don't like to hear this, but what you eat is like food is medicine.
Yeah, what you eat.
You really have to prioritize it. Then I mentioned exercise. And I'm not asking you to go out there and do the most difficult workout, etc.
Thank you very much.
1 hour walk 3 times a week. So a study was done.
Okay.
That is a bare minimum.
Yes.
Okay.
Yeah.
1 hour walk 3 times a week. Sufficient.
That's
Anything
doable.
that can replace that.
Yeah.
Yeah.
Okay.
So it's just about ensuring that you incorporate activity, and you are intentional about it.
Yeah.
Yeah. I've mentioned supplementation, but if this is quite severe, meaning she feels like, oh, I have these other symptoms. I have the acne, I have the facial hair, I have the weight gain, especially around the abdomen. Yeah. Then she can actually go see a gynecologist so that she can get the proper tests done. Yes. Because there are other hormonal issues that can happen. Yeah. The thyroid, as I've mentioned, insulin issues. So she just needs to ensure that she knows where she's starting from before she starts all these other things.
Yeah. All right. Does the color, the shade of color matter? The shade of menses,
So no, it doesn't matter.
Doesn't matter.
Maybe it matters to you.
Yeah.
As this, but it doesn't matter. However, there is a range. Yeah. There is a range of the type of blood. Yeah. And it can range from fresh, like bright red blood, to something that looks like rust colored to black. Depending on how long it took from the time it sloughed off the uterus to the time it lands on your pad. Okay. So that all influences the color, but it's normal. The only thing I'd say is the amount. Okay. So if you're changing your pad every hour or every 2 hours, it's full. Please, that's not normal.
So that's a lot of blood you're losing. My periods are late for more than 30 days. I am not pregnant. What could be wrong?
The hormones. But also stress.
Yeah.
Also stress.
Yeah.
So let me start with explaining how stress contributes. Yeah. So when you have, in the olden days, fight or flight was running away from lions. Yes. Now fight or flight is deadlines at work, money problems, or relationship problems, or many other things that the body interprets as stress. Yes. And so when the body is dealing with stress, it decides to prioritize what is needed. Okay. And childbirth is not high on the priority.
Oh dear, it's not high.
If you are going through all these factors. Yeah. So if you are going through stress in any facet of your life, it can impact
your cycle.
Because even though we've spoken of estrogen and progesterone, they're influenced by hormones that start from the brain. And the brain is the one that signals when there's stress. Immediately it gets that signal, it's like, okay, these other hormones that we usually release, FSH, LH, stop them. So then you don't ovulate. If you don't ovulate, you can't have a period.
Does that also explain how sometimes even travel just throws your cycle off? It's all of that.
Because environmental changes, for you, you're like, but that's not a big deal. Why is my body changing? The way your body works, it's used to seeing certain things as it's normal. If it now has to sieve new information, it can, your brain is feeling stressed, you're not feeling stressed. So your brain has decided, no. We're in a new place, we don't understand what is happening, so it changes. I didn't mention the hormonal imbalances. So when we speak of possible issues that are affecting her flow, we know Picos is high on the list, polycystic ovarian syndrome, but also other issues such as hypothyroidism or hyperthyroidism. It can affect your cycle. So getting screened is very important. I advise, if you've only missed 1 month, don't stress. Allow for your body to reset itself. But if this is a repeat occurrence, so you've missed this month, the next 2 months it comes, and then you miss 3 months, please, you need help.
Also makes me think, I doubt she's, this is for her, but for women who are also getting older, there's the issue of perimenopause where your period also starts to become scanty. So 1 month you see it, 3 months you see it, and then it starts to disappear. So there could also be that depending on your age, right?
Yes, and you've mentioned perimenopause, but there are women who undergo like early menopause, like premature ovarian failure. This is worst case scenario. I want to make it clear. I don't want her to start freaking out. This is if you Google. Yes, and even perimenopause, it's divided into early perimenopause, late perimenopause. Early perimenopause, actually, menses increase. And then mid to late, they start reducing. So it's also important for women to know when it goes from 28 days to 21 days now.
It's more frequent.
It's because those hormones have started to fluctuate. They're starting to confuse your system. So your system doesn't know what to do. So it's one of the hallmarks for early perimenopause.
Oh my goodness. Oof, women. Are clots normal? Are cramps normal? Is it normal to have a regular cycle and be infertile? Is low ovarian... It's like a lot of questions.
I think let's break it down.
Are clots normal and are cramps normal? Let's stop there.
Clots, depending on the size, can be normal. Again, because if the blood is taking a long time to come out, it gives it time to coagulate. But usually the size is like this. That's normal. But if the clots are large and the bleed is heavy, then it can be things like fibroids, polyps, or other things that need to be checked out. Also, estrogen dominance can cause a lot of heavy bleeding and sluggish blood coming out, and the clots increase. So if it's a bit abnormal, like the size is more than a 20 bob or something like that, then it needs to be checked. Cramps. I want to veer away from using the word normal because there are some people who are going through a lot in terms of menstrual pain. So I will say that there is some menstrual cramping that comes as a result of prostaglandins. Those are released to help push the blood out. So contract your uterus a bit. And that said, women also have different pain tolerances. So there are people who respond to prostaglandin a bit different to other women. You've had the prostaglandins are also released when you are giving birth.
Yes.
You've had the women who, for them, it's so painful.
Yes, yes.
And then there are women who are like, oh, I felt nothing in childbirth.
It was just that, yeah.
God's favorite.
Yes.
Yeah, so prostaglandins themselves can cause this discomfort. But if you are able to manage it with a hot water bottle,
yes,
you can take, let's say, a tab of brufen or paracetamol, and you're okay, then we say that that is likely it's the prostaglandins, so you can manage. It's okay. We don't need to intervene. But if that pain is causing you headaches, nausea, you can't even stand, that is not normal. That pain is actually a sign that something is wrong in all other facets of medicine.
Right.
Except women's health.
Yes.
But I just want to say that there are conditions such as endometriosis, adenomyosis that can present with a lot of menstrual pain.
Right. Yeah. So you would need to get checked for sure.
Yeah.
Is low ovarian, okay, let me not even go into that. Is it normal to have a regular cycle and be infertile?
Yeah.
Yeah.
Because fertility, we can look at it in 4 ways.
Yeah.
Fertility is what is the quality of egg produced.
Yeah.
What is the quality of sperm? And then have they have the two met somewhere in the fallopian tube. And after they meet and the fertilization takes place, has implantation taken place. So it's not just about the blood.
Yeah.
So that means if you're not producing healthy eggs, it can be affected from there. If the hardware is affected, hardware I mean the uterus, the tubes, they're blocked, etc., that can affect fertility. If the sperm quality number, etc., is not good, it can also impact fertility. And then if you're having the conditions, as I mentioned, endometriosis, that cause a lot of inflammation in the uterus, it also impacts implantation. And some people also have chronic autoimmune diseases that also impact implantation. So it's quite wide. That's just
it's a lot.
Yeah, it's a lot. So it's not just the bleeding that confirms, hey, I'm fertile.
I'm healthy, I'm good. Yeah. So it's important for you to just go get a specialist to check you out.
Know yourself.
Know yourself. For sure. Each time I'm post-delivery, my periods resume after 1 year. In between that time when there's no period, I have occasional cramps that are sometimes monthly, sometimes after 3 months, but no period. What could be the issue?
So this happens. So we say some women, their menstrual period can come 6 weeks after giving birth, but for some it takes up to 1 year because you're breastfeeding. And when you're breastfeeding, there's a hormone that is released from the brain called prolactin, and it suppresses ovulation. Remember I said no ovulation, no conception. Now she's asked about the cramping. I don't know if you remember, but I remember mine. Before I actually started my periods, before I ever saw my periods in my life, I used to have cramping.
Oh, I don't remember.
I used to have cramping. So even though the prolactin is being released, your body is still trying to jumpstart ovulation. Okay. And that can come with cramping.
Yes. So it makes sense.
Yes, so that can happen. And it's still considered normal. I know she's worried because it's a whole year.
Yes.
Personally, I'm feeling like she's also God's favorite.
A whole year without period.
But so long as she's breastfeeding, she does not have any issues. If the cramping is causing very severe discomfort, again, I say that's not normal. But if it's cramping where she can manage, it's actually normal. And it will come in a cyclic manner, even though she doesn't see the blood. It's just that ovulation tried, but did not.
It didn't succeed.
It didn't succeed.
Okay, since you have mentioned, we are at this place now actually of talking post-delivery, and you've touched on breastfeeding and what it does with the hormones. I have heard it said that when you're breastfeeding, you cannot get pregnant. But I have also heard it said that there are many women who've gotten the shock of their lives when they thought it was like a natural contraceptive method, breastfeeding was, but they got so surprised because they got pregnant. What is happening? How do you explain that?
And that's why, because we can't predict in which category you will land. We discuss contraception.
Yeah.
Unless your plan is to get that Irish twin.
Yes.
But if that is not your plan, we discuss it beforehand.
Okay.
And for lactational amenorrhea to work, so lactation, you're breastfeeding.
Yeah.
Amenorrhea, you're not having blood.
Okay.
For lactational amenorrhea to work, you have to be breastfeeding frequently.
Okay.
Okay. So you can't be breastfeed. Let's say you're going to work
in the morning.
And then you maybe pump somewhere at midday and then come back at 4 p.m.
Yeah.
No.
Yeah.
If you're not regular with feeding that baby. So in fact, women who really have successful lactational amenorrhea are those ones who the baby is always hanging on their boob. Yeah.
Feeding on demand.
Feeding on demand. And then there are women also, when they start weaning, they may see a dip in frequency of breastfeeding and their supply, right?
Yeah.
And that means that's also like a risky point for many women, where they get this unexpected, wonderful surprises. Yes. So I'd say for sure, as a gynecologist, I still advise you have to be intentional about your contraception.
Yes.
Lactational amenorrhea for some has worked.
Yeah.
But just, the same way contraception is not like 100%.
Yes.
So you just know lactational amenorrhea, the percentage of failure is not looking good.
So if you really, really don't want to get pregnant, then get on a contraception.
Get on a contraception. Yeah.
Okay. This lady says, I don't understand at all why I'm having periods with heavy blood clots for 2 months. I think you answered that question differently, right? Or to someone else. What causes sudden change in cycle length? For the longest time, my cycle has been 26 to 28. Over the last 6 months, there's been a change, least cycle length being 17.
So 17 days is not a normal cycle length. If the normal cycle length is anything between 21 to 35 days.
Yeah.
That's normal.
Yeah.
And when we say that your cycle is regular, it can have a 5-day variation. So that means if you have a 25-day cycle and then the next one is 28-day cycle, that is still a regular cycle, so long as it's within the 5 days. Anything less than 21 needs to be investigated, especially as she says, it's been 6 months.
Yes.
Something may be happening. Okay. So it can be something like fibroids, can be a polyp that is causing excessive bleeding. It can be a condition that leads to estrogen dominance. Estrogen dominance causes the lining of your uterus to increase. So you bleed a bit more. So if you have your estrogen is not being balanced by progesterone, it can also cause heavy bleeding. And we do manage that. We can actually give her something to help with that.
Okay.
So instead of going into anemia and the other complications that would lead to anemia, I think most women, you should have like a 3-month cutoff. Okay. If you've deviated from your normal for 3 months, get it checked.
Yes. I just love that women are asking these questions about their...
Same here. Very happy.
Yes. What are the symptoms to watch out for that are alarm ringers? I have had and still have crazy cycle from back pain, 2 to 3 day headaches. You talked about this. Nausea sometimes, talked about that too. Some days I am like sick. I've been to several hospitals, including the ones with big names, and they have all had the same report that everything is okay.
Oh, so
it's normal. But is it really, is what she's saying? I am 26 and sometimes I get scared at the thought of this happening all my menstrual life.
Yes, so this is part of the reason I became the menstrual doctor, because our training has a gap. In the sense that if we do tests and everything is normal, then it's all in your head. I think I mentioned this earlier. And I came to realize it can't be all these women have all these things in their heads. Right? So she's mentioned this discomfort. She has symptoms that are physical, related to the period, and she even has outside the system of the period. So she's possibly someone who is struggling with either severe PMS that is also associated with other conditions I had mentioned, endometriosis, adenomyosis, the back pain, the severe headaches, nausea. In fact, that nausea, because that nausea, it comes with the prostaglandins that cause a lot of pain.
Yeah.
And then they're also what are known as inflammatory markers that really cause a lot of inflammation as well, leading to these other symptoms outside the system.
Yeah.
She really needs to get checked by a gynecologist who will understand what they're looking for.
Yeah.
So if you go to a GP, they are not being malicious.
Yeah.
The system taught us that.
Okay.
I do the tests.
Yeah.
And if they're negative,
doesn't show anything,
I tell you, you are okay. There's no big deal. Other women go through this.
Yes. You
are not the only one.
Yeah.
Let me tell you, the people who faint because of menstrual pain.
Yeah.
They lose consciousness. They can't eat. They lose weight during the duration of their menses. And you can imagine the PTSD of, I know my menses are coming and I know this is what I usually go through.
Yeah.
Endometriosis is not diagnosed by, it's not usually necessarily picked up by imaging.
Yeah.
Our hormones are always in flux.
Yeah.
So that's also why we don't do certain hormone tests routinely.
Yeah.
Because unless we catch you on, let's say, day 2 of your period or day 21, we know that it can really fluctuate.
Yes.
We might get wrong readings.
Yes.
Sometimes for patients who need follow-up, we can do tests like for 3 months.
Okay. Wow.
Just to have like a record for them to understand. Yeah. I would say she needs to possibly go for laparoscopy.
Okay.
Because I'm not based in Kenya, I will say some of the doctors I know can help her.
Yeah.
So there is Chris Obwaka who can help hear her history and really answer her questions.
Yes.
I have another colleague, Dr. Pulei, who can really listen to them. These people are on social media as well.
Yes.
In case you're wondering.
Yes.
Dr. Majala, Dr. Flavia Ogutu. There are quite a number who I usually say the relationship between patient and doctor is like any other relationship, compatibility.
Right.
So someone may wonder, why am I listing out all these people? But there's also compatibility.
I might not be compatible with you, but I could try somebody else. Yeah.
So it's also about really advocating for yourself and not giving up.
Yeah.
The journey for getting solutions for menstrual health conditions is unfortunately long.
Yeah.
On average, fibroids take 4.5 years to diagnose. Endometriosis, almost 10 years before diagnosis.
Yeah.
So it takes so long because the system has made it. And again, these doctors are not being malicious.
Yes, it's how
medicine started as a profession that was male-dominated.
Yeah.
That means they were very intentional and they felt they were helping their patients.
Yeah.
But some of these things, having experienced them, makes a difference.
Yeah. I almost feel like that would be a perfect place to stop. But I'll take this one question and then we can wrap it up, because I feel like the rest of the questions are very similar to a lot of the things we've discussed.
Yeah.
I have this crazy cramping on the left side every time I'm on my period. Is it normally always on one side? What could be the issue? I am on IUD.
Okay. The fact that she's saying every time she's on her period, no, it's not normal.
Okay.
And then the words of crazy cramping, that means it's severe.
Yes.
Okay. So if she has the IUD, the first step would be, can she get the IUD checked?
Yeah.
So most women, they get the IUD and they're like, I'm done.
Yeah.
No, you should go annually to get it checked. If it's displaced to one side, it can cause some irritation on that side, some nerve irritation, etc. But there are other conditions that could be contributing to this. If she has a cyst on that side, and then every month the hormones are fluctuating, and those cysts respond to hormones. Okay, so it can also be due to that.
Right.
It can even be due to the same endometriosis we are talking about, because endometriosis is having the tissue that lines your uterus outside the uterus.
Yeah.
And if this tissue is on that one side, every month it responds to the same hormones. It responds to estrogen. And so causing that discomfort. So she needs imaging. She needs, do we have an issue with the IUD? Do we have an issue with cysts maybe on that side? Because the fact that it's every single month and crazy cramping, that's a problem. Not normal.
That's a problem. I think just listening to Dr. Achieng, the things, anything in excess cannot be good. The overly heavy bleeding, so much pain you cannot function, headaches, nausea, all of these things which we actually know this, hata mtu akikwambia hii ni kawaida, hata unajua hii si kawaida. Please find, and I like that you've said, a general practitioner may not know what to do with you because they're not trained to study and understand the menstrual cycle in detail, or rather your cycle in detail. But a gynecologist is the right person to see. Go look for a gyna. She's given us some names. There's so many out there who are able to help you. Dr. Achieng has a page, and I want you to tell us how we can find you on social media, because you do great content. And I think that some of these questions, even the ones we've not touched on, can be answered by content you have already done. Give us your pages, please.
Actually, you're right. There are some answers that, and I go a bit more in depth. So you can find me as the Menstrual Doctor on literally all platforms. All platforms. TikTok, Instagram, and Facebook. That's where I'm mostly active.
The Menstrual Doctor. You got it. You can follow her, check out the content, challenge yourself, and I'm challenging myself as well to understand my cycle as a whole, so that we can thrive, we can be, we can function in our optimum capacity, right? And even we can be the best for the people around us as well. Dr. Achieng, thank you. It's been such a pleasure.
This has been a great talk. I can go forever when it comes to menstrual health. So
even I am like, can we go on? But for today, we'll stop, and we'll try catch you when you're in Kenya again. Thank you.
Thank you.
All right, guys. We hope you have a wonderful, wonderful rest of your day. God bless you, and catch you again next time. Bye-bye.
A few months later, I was on a date with someone else at an event that Aling was photographer for that event. And at the end of the date, I'm sitting in the car, and Aling passes by in the parking lot, and he waves at me. I need to mention that that date didn't go very well. Like it was the first date, and it was also the last one. Yes. So Aling walks by my car, and he waves at me. And I was kind of surprised, because by this time, Aling is the one everybody knows. I've not released Kutembe Nawe outside of my little church circle. Nobody knows who I am. So I was kind of like, wow, he remembered me, because he just passed by and waved. And I don't know what came over me, but I slid into his DMs. I'm like, hey, I know you play bass. I have a studio.
Becca.
I'm working on a project. Would you be interested in coming to